Home Remedies for Removing Dental Plaque, a comprehensive guide. Welcome to our in-depth exploration of powerful home remedies for removing plaque. In this video, we'll explore 10 effective methods to combat plaque buildup and maintain optimal oral health. Dental plaque, also called tooth calculus, tartar buildup, or tooth scale, is a sticky film of bacteria that accumulates on teeth, can lead to dental issues such as cavities, gum disease, and bad breath if left unchecked. By incorporating these natural remedies into your oral care routine, you can achieve a cleaner, healthier smile without resorting to harsh chemicals or expensive treatments. What we eat influences the health of our body, and our teeth are not immune to the ravages of an unhealthy diet. As refined, simple carbohydrate consumption increases, so does the proliferation and overgrowth of karyogenic or tooth decay-promoting bacteria in the mouth. These bacteria require a source of sustenance, and carbohydrates serve as their primary fuel. It's important to remember that cavities stem from a bacterial invasion of the tooth rather than a mere infection. Therefore, reducing carbohydrate intake can lead to a decrease in bacterial growth and consequently a lower bacterial load within the oral cavity. This, in turn, results in reduced plaque formation and fewer instances of cavities. By moderating carbohydrate consumption, individuals can effectively manage bacterial growth in their mouths and promote better oral health overall. Refined carbohydrates swiftly undergo breakdown processes in the mouth, converting into sugars. This includes sodas, pastries, cereal, white bread, cookies, fruit juices, pizza, and many more. These sugars serve as a prime source of sustenance for oral bacteria, which are responsible for the formation of plaque. As these bacteria feed on sugars derived from food, they rapidly multiply, leading to the accumulation of plaque on teeth surfaces. This plaque, if not adequately removed through oral hygiene practices, can contribute to various dental issues, including cavities, gum disease, and bad breath. Therefore, being mindful of food choices and minimizing the intake of refined carbohydrates can help reduce the availability of sugars for oral bacteria, consequently mitigating plaque formation and promoting better oral health. Let's discuss another much less talked about cause of the formation of dental plaque. This one is focused on certain plant-based foods. Oxalates are naturally occurring compounds found in many plant-based foods. They are formed through the metabolism of certain nutrients, such as vitamin C, as well as from dietary sources. Oxalates can bind with minerals like calcium and form oxalate crystals. These crystals, which are like tiny shards of glass, are then excreted from the body through urine or feces. While oxalates are found in various foods, including fruits, vegetables, nuts, seeds, and grains, some foods are particularly high in oxalates. Examples include spinach, rhubarb, beets, nuts, seeds, and chocolate. Oxalates play a role in plant defense mechanisms, helping plants deter herbivores and pests. In the body, oxalates can bind with calcium to form calcium oxalate crystals. Excessive consumption of oxalate-rich foods or conditions that lead to increased oxalate production can result in the accumulation of these crystals. In some cases, the crystals can deposit in tissues and organs, leading to health issues such as kidney stones or contributing to conditions like hyperoxaluria. While oxalates are a natural component of many healthy foods, individuals with specific health conditions, such as kidney stones or certain types of kidney disease, may need to moderate their oxalate intake to manage their condition effectively. Avoiding oxalates from vegetables can lead to a phenomenon known as oxalate dumping, which may contribute to dental plaque formation. Oxalate dumping occurs when the body suddenly releases stored oxalates into the bloodstream due to a reduction in dietary oxalate intake. When oxalates are consumed in high amounts, they can bind to calcium in the body and form oxalate crystals, which are then stored in various tissues, including the kidneys and teeth. However, when oxalate intake is reduced, the body begins to mobilize these stored oxalates, releasing them into the bloodstream for excretion. This sudden influx of oxalates in the bloodstream can lead to various symptoms, including dental plaque formation. Oxalate dumping may result in increased oxalate levels in saliva, which can promote the formation of dental plaque. The oxalates may bind to calcium ions present in saliva, forming calcium oxalate crystals, that adhere to tooth surfaces and contribute to plaque buildup. The duration of oxalate dumping can vary from person to person and depends on factors such as the extent of oxalate accumulation in the body and individual metabolic rates. Symptoms of oxalate dumping, including dental plaque formation, may last for several days to weeks as the body continues to excrete excess oxalates. To minimize the risk of dental plaque formation from oxalate dumping, individuals should gradually reduce their dietary oxalate intake rather than making sudden and drastic changes. It's essential to maintain good oral hygiene practices, including regular brushing and flossing, to help remove plaque and prevent dental issues. Additionally, staying hydrated and consuming foods rich in calcium can help mitigate the effects of oxalate dumping by binding to oxalates in the digestive tract and reducing their absorption into the bloodstream. Consulting with a healthcare professional or registered dietitian before making significant dietary changes is advisable, especially for individuals with a history of oxalate-related health issues. After considering the root cause and how diet plays a role in the formation of dental plaque, let's move on to more home remedies for removing plaque naturally. Oil pulling is a traditional Ayurvedic practice that involves swishing oil around in the mouth to remove bacteria and toxins. Coconut oil, sesame oil, and olive oil are popular choices for oil pulling due to their antimicrobial properties. Simply swish a tablespoon of oil in your mouth for 15 to 20 minutes before spitting it out and rinsing thoroughly with water. Baking soda, or sodium bicarbonate, is known for its abrasive properties that help scrub away plaque and surface stains from teeth. Create a paste by mixing baking soda with water and apply it to your toothbrush. Gently brush your teeth with the paste for 2 to 3 minutes before rinsing thoroughly. Apple cider vinegar contains acetic acid, which has antimicrobial properties that can help kill bacteria in the mouth. However, due to its acidic nature, it's essential to use apple cider vinegar sparingly to avoid damaging tooth enamel. Dilute 1 tablespoon of apple cider vinegar with water and use it as a mouthwash, swishing it around for 30 seconds before spitting it out. Lemon juice contains citric acid, which can help break down plaque and whiten teeth. However, like apple cider vinegar, lemon juice is acidic and should be used cautiously to prevent enamel erosion. Mix equal parts lemon juice and water and swish it around in your mouth for 30 seconds before rinsing thoroughly. Aloe vera gel is well known for its soothing properties and ability to reduce inflammation. Studies suggest that aloe vera may also help inhibit the growth of bacteria that contribute to plaque formation. Apply a small amount of aloe vera gel to your toothbrush and brush your teeth as usual. Tea tree oil is a natural antiseptic that can help kill bacteria in the mouth and reduce plaque buildup. Dilute a few drops of tea tree oil in water and use it as a mouthwash, swishing it around for 30 seconds before spitting it out. Be sure not to swallow the solution, as tea tree oil can be toxic if ingested in large amounts. Guava leaves contain compounds with antibacterial properties that can help combat plaque and prevent gum disease. Chew on fresh guava leaves for a few minutes, or boil them in water to make a mouthwash. Turmeric is renowned for its anti-inflammatory and antimicrobial properties. Create a paste by mixing turmeric powder with water and apply it to your toothbrush. Gently brush your teeth with the paste for 2 to 3 minutes before rinsing thoroughly. Incorporating these powerful home remedies into your oral care routine can help remove plaque naturally and maintain optimal dental health. However, it's essential to remember that these remedies should supplement, not replace, regular brushing, flossing, and professional dental cleanings. By combining natural remedies with proper oral hygiene practices, you can achieve a cleaner, healthier smile and enjoy the benefits of natural dental care. Thank you for watching. Please like, share, comment, and subscribe to Remedy Seeker for more health tips, and we'll see you in the next video.